One of the biggest questions I get asked constantly and during breast augmentation consultations is whether to use a silicone or a saline implant. And right now, I think in the United States, 70% of implants are silicone and 30% or less maybe are saline implants. We have watched an evolution of that over the last 7 years since the FDA approved the use of silicone breast implants in 2006. So little by little I've seen patients choose more and more silicone breast implants. Now most of my patients will choose silicone breast implants first over a saline implant, but there's still some people that would choose to have saline. What is the big difference? The difference is that saline implants come empty to begin with, and then we can fill them up through this little port in the operating room to the desired size. They will allow some overfill, which allows for some adjustments. That is an advantage of this kind of implant. But the implant is filled with saline, so therefore it has a lot more mobility and motion. In weight-wise, it is it's a little heavier than a silicone implant. The implant also has a tendency to form little creases, what we call scalloping, that can be felt through the edges of the implant. So, in my opinion, silicone implants are as safe as saline implants, but saline implants perform a little under the quality of the performance of a silicone breast implant. So I tend to advise more the use of silicone implants than saline. But there's some patients that will still prefer the use of a saline implant, and I don't have any problems utilizing them since I'm very adept to using them as well. I have seen a lot of patients that I've done in the past with saline implants come back and ask for a replacement with silicone. And the overwhelming majority are much more satisfied with the silicone breast implants.